Happy Thursday, everyone. I know there's a lot going on, and it can be difficult to keep track of all of the information and changes. And because this is such a dynamic situation, there are a lot of changes. We are continually doing everything possible to adjust and adapt our policies and procedures based on the best science and guidance from medical and health professionals. One recent change is our approach to testing. We are testing all students and employees who may come to campus and could contract the virus. That includes people who are asymptomatic, as well as those who might have been quarantined as a result of being a potential contact of a known case. So to be clear, at this time, the only people who do not have to be tested are those who never plan to come to campus or already have received a positive test within the last 90 days. Everyone else has to be tested. We're suggesting that everyone who's quarantined get a test 5 to 7 days before their quarantine is scheduled to end. That's because if you do test positive, it can decrease the time that you have to wait to be cleared to return to campus. So it's to your benefit. So what's the status of weekly testing? Well, about a third of campus received an email yesterday asking them to go online and schedule a test for next week. I got the email and I scheduled my test for Tuesday afternoon. If you already had an SU test scheduled for next week, you can feel free to keep your appointment. If you were tested last week, you can get another test next week to push your 30 days back, or you can wait until future dates become available. The key is that everyone must participate in a new test within 30 days of their last test. You will receive an email on a rotating basis to do this, or you can sign up on your own at any time. As I mentioned last week, we're having expanded testing for 4 days a week and increased hours to make it more convenient and to decrease the wait times. We have also introduced self-swabbing. When you go to schedule your appointment, there are options for appointments where professional staff conduct the tests and when there's only self-swabbing. A registered nurse will be present at all times to assist if you intend to self-swab but need assistance. Please visit SU's COVID-19 website to sign up for testing, or if you have questions about testing requirements, protocols surrounding positive tests, isolations, and quarantine requirements, and more. There are flowcharts and a wealth of resources. Now, I know some of you are thinking that this is all too much hassle and you're going to wait to sign up for a test. Don't wait. If you put this off until the last possible moment, you are going to be in a crunch with all of the other people who did exactly the same thing. If you just make your appointment on time and keep it, I think you'll be in good shape. I am very happy to share that our positivity rate is going in the right direction. As of this morning, our weekly rate is under 4%, and I want to thank all of our students and employees who are taking their responsibility for health and safety seriously. If we work together, we can protect the flock. It looks like what we're doing is now working, so let's keep the momentum and make it through the semester together. Now I'm going to turn to my Chief of Staff to answer any questions that you might have. Eli, what questions are out there?
Thanks, Dr. Wight. The first question has to do with changes to course modality. Can you talk about why courses might be changed during the semester after they've already begun?
Sure. Over the summer, we gave faculty choices about the modalities in which they expected to teach. And we gave students the choices of which modalities they wanted to take their courses. Some chose in-person, face-to-face, some chose hybrid modalities, some remote, and some completely online, both faculty and students. And what we tried to do is meet in the middle somewhere so that most people could get most things that they wanted. But circumstances change, health conditions change, and some faculty have changed the way that they teach their courses, mostly going more toward remote and online. And some students have also changed their preference about how they want to take courses. Again, mostly going from face-to-face to more remote. So unfortunately, we can't be all things to all people, but what we strive to do is to provide the best educational environment in an environment that is also very safe for people, both teachers and students.
The next question is about Thanksgiving break. Will students be returning to campus to finish the semester, or will they be staying home and finishing the semester online?
There's been a lot of talk about what happens after Thanksgiving, and I know that some other institutions have made plans to go online after Thanksgiving. We are planning to stay in our current mode, whether it's hybrid, face-to-face, or remote or online, after Thanksgiving. Now, as always, circumstances could change, and we might have to make a change on that. But for now, we are planning to keep the same modality after Thanksgiving, so plan to come back after Thanksgiving break and finish out the semester here.
Dr. Wight, this student is asking why it's important to have so many restrictions if, in large part, college-age students do not become extremely ill with the COVID-19.
Wow. You have heard in the press where there are sometimes unknown long-term consequences of the disease, and particularly for some student athletes, there may be dangers that we have not previously recognized. So it is important for everybody, regardless of your age, to be very careful and try to avoid getting the disease. It's true that many young people have milder symptoms, but you have to think of others as well. You have to think of your teachers, many of whom, like me, are older than college age, some of us considerably older. And you also have to worry about people in families. So if you are planning to go back home for Thanksgiving break, for example, you don't want to be carrying COVID back home to your parents or perhaps your grandparents. So it's in our best interest and also in the community's best interest for everybody to avoid this disease as much as possible.
This person asks when they can expect to receive an update about graduation.
We are going to have an update about graduation very soon. We are working out some details right now, but expect an announcement about graduation for 2020 graduates very soon.
This next question, I think you addressed last week, Dr. Wight, but it talks about where tests are counted. So essentially, this example, if a student is from Annapolis and they test positive at SU, where are their results counted? Which county health department is responsible?
Right. So it turns out that a lot of the COVID response is being done state by state. And so if a student is on campus but has a permanent address in Annapolis, then your COVID test would be reported to the county health department in Anne Arundel County, where Annapolis is. And that county would technically be responsible for the contact tracing. We have been supporting contact tracing for all of our students by getting the ball rolling as soon as we find out about a positive case from a test that we run. But it is the county health department in your home county or perhaps in your home state that is responsible for the reporting and the contact tracing.
Another question is about employees that live far away but plan to come to work. Essentially, would they still have to get the test at SU?
Yes. If an employee lives in Delaware, for example, or across the bridge in Montgomery County and commutes a long distance to work, it is important for you to have a COVID test on our campus. And that's because we have a lot of difficulty finding out about the results of tests that are conducted off campus. And so the only way that we can be sure that you're cleared to come to campus is if you have a negative test on a test that's run by SU.
This question is about activities for students given COVID-19 precautions. Is SU planning on physically distanced activities for on-campus students, such as outdoor bingo, outdoor movies, and things like that?
We have a lot of physically distanced events scheduled for students. Some of them are run by student affairs, others by campus recreation. There's a whole list of things to do. Eli, do you know of a particular website or websites where students can find out about these activities?
So, Dr. White, I think there's actually a link going up on the COVID page that links to all the different activities available for students. And there's also emails that come out from Student Affairs to all of the students.
So yes, we will have activities for you, and they will be socially distanced.
This is a question about the sharing of data. If someone tested positive, not using an SU test, would their data still be added to SU's pool?
The answer to that, I believe, is no. The data that we report on our website is only for tests that we have conducted. And there are many reasons for that, including that sometimes we can find out about outside tests and sometimes we can't. Sometimes the tests are different types of tests, like the rapid tests, which have a different sensitivity than the PCR tests that we have run at University of Maryland, Baltimore. So in order to keep all of the data meaningful, we have not mixed and matched data. And so the results that we report and the results that we use in making our decisions are based on the tests that we run. And that's why it's really important that if you're coming to campus at all, you have a test that's run by SU, because that's the only way we can clear you to come.
This next question is again about the frequency of the weekly testing or the monthly tests. Will students be tested again after Thanksgiving break is the question.
Yes, every 30 days you're going to have a test. If our rate of positivity remains at or below where it is now, then I think that will be probably an every 30-day requirement. If we experience a jump in positivity rates, we might have to go more frequently, but for right now, every 30 days, including after Thanksgiving.
So this question is something that you addressed last week, Dr. White, and it's about the difference in the quarantine and isolation period. And their question is, why is it 10 days for a positive, but 14 days for the close contact of that positive?
So if you are quarantined because you've been identified as a close contact of a positive, then from the date of that close contact, there is an incubation period and a period where you may be sick, whether you're symptomatic or not, and then a recovery period. And the science shows that it takes a full 14 days to go through that whole period. But if you test positive, then you have already been through the incubation period. And so you've been positive for some number of days even before you had the test. And so the science tells us that we only have to make you wait 10 additional days after your test before you can be cleared to come back to campus.
Two more questions on testing. The first is, why, if a student is put into quarantine and then tests negative outside of SU, can they not come back to campus immediately?
Well, again, if you're tested outside of SU, then we don't know anything about the sensitivity of that test or really what kind of test was done. So it is important to have an SU test, because then we know it's a PCR test of a certain type with a certain sensitivity, and we can be confident to clear you to come back to campus once your quarantine period is done. But I want to repeat something that I said at the top of this briefing, and that is, if you are quarantined, get a test 5 to 7 days into your quarantine period. That's because if you test positive, then you'll only have to wait an additional 10 days potentially to be cleared to come back to campus. But if you wait until the end of your quarantine period and then test positive, then it's another 10 days that you would have to wait. So it's important that you get an SU test because we know exactly what kind of test it is and what the sensitivity is. But it's also important that 5 to 7 days into your quarantine period, you also have a test. And you can do this on demand. You can just go to the SU coronavirus website and go to our testing scheduling site and sign up for a test at any time for any reason.
This person asked a question I think you addressed earlier, and that is, do you have to get a test if we are all online?
If you never, ever plan to come to campus this semester, then you don't have to have a test. But some students are going to have to come to campus to take an exam, for example, or you may have to come to go to the library. To do anything on campus, you must have a negative test result on file. So testing is easy. It doesn't cost you anything, so you might as well do it. Just sign up. With the self-swabbing option now, it's easier than ever. And with the expanded hours, you're not going to have to wait in a long line. So might as well just do it.
Dr. Wight, is there a specific percentage or number of cases that SU is looking at to make changes such as shutting down or going all online?
No. As we have said before, there are about a dozen different factors that we take into consideration in making any decision about changing operational status. And so there isn't one single number. I'll be frank with you, when our numbers jumped from below 1% to around 6% after Labor Day, then there was a question in all of our minds about whether we were just on the cusp of a positivity rate that was going out of control. And that turned out not to be true. But nevertheless, there are many, many factors that we take into consideration, and we make these decisions in communication and collaboration with our county health department. Okay. I think that's all the questions we have. So please remember to check the website for additional information and updates as they become available. Before we close today, I would like to reflect on 2 lives that have been heavy on my mind recently. The first one is Supreme Court Justice Ruth Bader Ginsburg. As you know, Justice Ginsburg passed away last Friday, and her work, not just for women's rights, but for equality for all, leaves me deeply sad, but also eternally grateful for her advocacy and for her resolve. We are a better nation because of her work. The second is Breonna Taylor. This week, we learned that the officers responsible for Breonna's death are not being charged for her murder, and this leaves me both sad and angry. But this in no way diminishes Breonna's life or the activism that she inspired. I will continue to join you in saying Breonna's name and remembering her. And this leads me to 2 last reminders. Tuesday was National Voter Registration Day. I encourage you to visit the website for our Institute for Public Affairs and Civic Engagement, PACE, for details on how to make sure that you are registered to vote. Also, next week is the deadline for the U.S. Census. Students, please visit the Census website to participate to make sure our community is accurately counted and represented. It's important. Thank you all for tuning in, and we'll see you right back here next week. Stay safe, Seagulls.